Thank you, Chairman. We're now live.
Great. Thank you very much. I'd like to welcome everyone to this meeting of the Local Outbreak Engagement Board for the 2nd of February. I'm Councillor Mark Brunel-Walker and I'm stepping in to chair this meeting at the start. Item 1 is to receive any apologies for absence.
Chairman, I've been provided with apologies by Elena Rosell, Tessa Lindfield and Andrew Hunter. Any members of the board who are not providing their apologies in advance and who do not appear in the meeting will be recorded as having provided their apologies.
That's great. Thank you very much. Do we have any new people for the call today? I think Sarah Bellas is joining later. Is that right?
I believe so, Chair, yes.
That's correct.
Great. Okay.
Item
also,
2,
Mark,
the Councillor Bettison has given his apologies that he'll be a little bit late joining.
Yes, thank you, Chief Exec. Right, moving on to declarations of interest. Does any member have any interest to declare in the meeting this afternoon? I shall look for exceptions in the chat. And there aren't any. Item 3 is, are there any urgent items to be considered this afternoon?
Chair, I'm not aware of any.
Thank you. Moving on to agenda item 4, to review the current data that relates to the levels of COVID-19 infection rates nationally and within the borough. Over to you, Charlotte.
Thank you, Chair. I'll just share my screen with you all. Is everybody able to see the screen?
Yep, that's good.
Yep.
Okay, so as normal, this presentation has been taken from the published weekly presentation on the Public Health Berkshire dashboard, pulling together information and surveillance across the 6 local authorities in Berkshire and focusing in on Bracknell Forest. So in terms of our situational awareness this week, between the 20th and 26th of January, which is where we have the most complete data available to us, there had been 325 new cases of COVID-19, and that made up 5% of all of Bracknell Forest's cases across the entire pandemic. So as I've reported in previous weeks, this continues to reduce down. Around the Christmas period, New Year period, we were seeing a percentage of sort of 20 to 25% of our cases being seen on a weekly basis, and that has reduced significantly. The weekly rate is 265.2 per 100,000 population during this period. That was 24% lower than the week before and 45% lower than the week before that. And in our vulnerable over 60 population, the rate has decreased by 27% in the last week and was sitting at 276.4. Now you can see, whilst it's a good news story in terms of the reduction in the rates, and we can now confidently say that there has been a statistically significant decrease in our rates from around the 24th of January, that actually we still remain in this deep dark maroon red colour, and there's still a long way to go in terms of where we need to be. I have looked at the rate today and it's further reduced. Our weekly all age rate per 100,000 is now at 251.3, so still continuing to move in the right direction. Now, the rate in the over 60s hasn't been falling in the past weeks as quickly as our rate across all ages, which was a concern, and we were looking into to see what was happening around that. However, this week it's reduced again and has come down to 215.4 today. So I think what's happening, it's a smaller population group, and therefore slight noise within the number of cases was affecting the rate overall. We saw a particular spike in our over 90s, which was explained with a number of cases within care homes, and also a number of cases that had been admitted into hospital. Unclear at this stage as to whether that was individuals who were tested in hospital but had the coronavirus before going into hospital. So I think we can confidently say now that the over 60 vulnerable population is reducing in line with the rest of the age groups, but we will continue to keep an eye on that. In terms of our testing, again, there's been a slight reduction in the numbers that have sought testing, but that's would be expected with less people experiencing symptoms and therefore not requiring to go for a test. But in line with that, we've also seen a reduction in the number of, or the proportion of tests undertaken that were positive. So again, indicating that there is a reduction in community transmission locally. How we compare across the patch, rates are reducing across all of our neighbouring local authorities in Berkshire, and we are now below the South East average when it comes to our case rate per 100,000, slightly above it up until the 26th, but again, when I've checked today, it's brought us back in line with what's going on in the southeast in terms of our over 60 population. So all moving in the right direction and a more positive spin. I just wanted to reiterate this, that whilst it, as I've said, whilst it is moving in the right direction, we're still rating either red for positivity or maroon for the weekly rates for all ages and in the over 60s. And so we've still got a long way to go till we get to this safer green zone down here. These graphs just show us pictorially what that case rate looks like over time, and you can see for Bracknell Forest in this top left-hand corner, our blue line is the rate locally, orange is the rate across the southeast, and the grey is the national rate. So a steep decline in numbers following a national lockdown after the Christmas period, and then a sort of levelling out, and then a continued decrease in line with what's going on across the southeast and the rest of the country. What we are seeing locally, however, is once we get to this sort of 400 cases per 100,000, as you can see here in West Berkshire, and ourselves, and sort of here over in Wokingham, is that decline starts to level off. And again, we just need to remain vigilant, to continue to adhere to the lockdown rules and regulations, to continue to practice hands, face and space rules, to really continue to make sure that decline in the rate continues over the next few weeks. Just to have a look at what that looks like geographically across the map, we can see Bracknell Forest is number 1 here in the centre of the map, and generally across the patch, everybody is now within this 250 to 450 cases per 100,000 population. There's a few hotspots, Slough continuing to have higher cases, and also Rushmore as well. Reading's coming down, but not quite as quickly as the counterparts across the rest of Berkshire. But on the whole, this map is becoming lighter and lighter blue every week that I present. When we look at our wards across Bracknell Forest, now this is the previous week's data. This week's data has only just come in, so I won't be, but that will be available on the dashboard as of Wednesday or Thursday of this week. But we can see, as always, there are a number of hotspot areas that sort of jump out that we're continuing to track. What we have in Bracknell Forest, when we look at ward level data, the numbers are very small. So we're looking, even in the hotspot areas, numbers of 40 cases and 35 cases. And it means that slight variations can cause big jumps in the rates. We know that in terms of Crowthorne, we've got a number of cases that are associated with Broadmoor Hospital that explains that to a certain extent. And we've continued to look at the hotspot areas around Wild Ridings and Central, and also College Town, where we knew that there were some cases at Sandhurst Military, and also Binfield and Warfield. But as we track that over time, there's no consistent patterns that we're looking to cause any sort of concern in terms of hotspot geographical areas. And this just shows it in a map. And again, you can see here number 7, the Crowthorne ward, which is darker blue this week. But as the weeks go on, all the wards tend to sort of experience the darker shades every now and then. So at the moment, there's a particular high number in Crowthorne, but nothing in terms of an onward trend that we're concerned about. And when we look at our where the transmission is occurring, it still remains that 90% of our transmission is occurring within a residential setting, so house-to-house household contacts. A number of cases from care homes, but nothing that we're overly concerned about at the moment. So still reiterating the importance of maintaining hands-face space within household settings, and also when individuals are tested positive or do experience symptoms, the importance of trying to limit contact to protect the rest of the household from onward transmission. Finally, just having a quick look in terms of the cases at the demographics and what who those cases are. We know that generally in Bracknell Forest, the cases split evenly between females and males. The previous week, up until the 21st of January, we had seen a bit of a spike in cases in BAME groups, 21% of our cases, which is higher than what we would expect for that group. However, this week, the data has just come in and is showing that that's returned back down to 16%. So again, another blip in the data. And when we look at the breakdown of ages, again, as the pattern has been previously, the vast majority of our cases are from 18 to 64 years of age. So briefly touching upon hospital activity, these graphs look at the hospital activity for Frimley Health Foundation Trust, and we can see over the top graph looking at the number of patients admitted with COVID-19 to Frimley, and the bottom looking at the number of patients currently in hospital with COVID-19 at Frimley. So we've started to see that challenging increasing rate starting to level off over the sort of period of January, but still the number of individuals that remain in hospital with COVID-19 is extremely high, so it's leveling off at an extremely high level, putting pressure onto our NHS resources and colleagues. And a very, very similar picture for Royal Berkshire NHS Foundation Trust. Again, that increasing trend beginning to level off, but those in hospital still climbing slightly for that trust, not seeing that levelling off quite yet. And then unfortunately for deaths, there were 15 deaths recorded for the last week up until the 15th of January in Bracknell Forest. This takes our total to 121 COVID-related deaths during the pandemic. When we look at what would be expected in terms of the average that we've seen over the past 5 years, this is the grey line, we can see the last couple of weeks, the number of deaths in total are the bars, the orange section showing the non-COVID related deaths and the blue section showing the COVID related deaths, that they've started to increase. And up till the 15th of January, actually that week exceeded, in terms of the confidence intervals, exceeded what would be expected. So how we interpret that is that it's significantly higher number of deaths than what's expected during that week. Something that we were keeping an eye on and looking at our services locally and the impact of those. It has come down this last week and return back in line with what would be expected. So again, a bit of a peak last up until the 15th, but that trend is something that we'll keep an eye on, given the high number of individuals experiencing severe illness and in hospital at the moment. So just to again, reiterate the importance of the Berkshire Public Health website. There's lots of information on that website. The dashboard and the data is updated daily. Presentations similar to this are published on a weekly basis. And we've also got a lot of information around testing as well now uploaded onto that website, in terms of where you can access testing if you're experiencing symptoms, and information about the new community-based testing using the lateral flow testing. That's all on there. There's lots of information in the information centre as well, so I'd really direct people to that website. And just the updates, as I've mentioned, there's the testing information, but also another new social media campaign about Don't Be the One that's launching across Berkshire to motivate and mobilise the younger residents. So that's on there as well as some video stories that have been shared locally also. And I will pause there.
Great, thank you for the excellent and comprehensive update. And it's, I guess, dare we kind of look to the direction that it's going in and hope that it continues. And thanks for all of the work that everybody does. Questions from members of the board?
I'm not a member of the board, but can I speak? It's Councillor Mrs. Hayes.
Go ahead, Councillor Hayes.
Yes, can I ask the question with regards to park homes and different others, particularly I can see Councillor Barnard is here, and it is one in particular would be the Warfield Park. How have we got out there? Because that is the majority, that there's a substantial amount of members up there, or persons, I should say. How have we taken the message out there to them? Because that is something I wasn't sure whether we had taken park homes into the equation.
Are you talking about testing or messaging?
Testing or both, actually. We could, because this
So
is where
we leave
come across the question.
I think we can deal with the messaging part later. The testing is probably a good segue into discussion on flow testing and the community testing that's going on. But Gareth, have you got another question on the same topic?
My question is, do we think we're being successful in reaching out to the people who've had the jab so far, just to remind them that the efficacy doesn't kick in until some 3 weeks after? And this is in the context, of course, that with more challenging emerging variants, that the response, although effective in many circumstances, might just need the time required to bed in, because I think we're hearing about one or two, not in Bracknell Forest per se, but one or two more challenging situations where people have caught COVID in the immediate aftermath of having the jab, and that therefore
who would like to answer that one?
For the benefit of those on the board, that very sadly it's just been announced that Captain Tom Moore has passed away. For those that have been following the news, so that context, it's really important for other people to protect themselves. But just a comment on that, Charlotte.
Yeah, so in terms of the vaccination communications, that's very much being led by our colleagues within the NHS, and we're continuing to support them in getting that message out to local residents. But the messages, Fiona and Sarah, I'm sure you'll be able to provide more information on this, but certainly is clear around when individuals receive their vaccination in terms of the risk and what that vaccination offers to them, and to continue to take precautions to protect themselves from transmission and the risk that poses to them. Fiona, Sarah, do you want to add anything in terms of the NHS communication programme that's underway?
Yeah. Thank you, Charlotte. It'd be really interesting because it's a really critical part of what we're doing, isn't it?
Sarah, do you want to come in? And then I'll come in after you.
Sorry, I was trying to get the right button and I was looking for Teams and obviously it's Zoom, so I apologise. Yes, I think that the messaging is very clear about vaccines, and actually, Gareth, not just the first vaccine, but the second vaccine, and also about protecting other people.
Yeah, that's important.
Even if you
thank
protect yourself, you know, you've got some degree of protection for you. And remember, currently what the vaccine does is probably stopping you from dying. It's not stopping you from catching it, or you know, it's about reducing the burden on the NHS rather than anything else. And we do try and get that message across, but we will need that echoing from all partners across the system, I think.
Thank you for that. I think the second vaccination is an important message as well. I think it's really good that we highlight that, you know, that protection isn't there time after antibodies develop. Yeah.
Fiona, did you want to add anything on that?
Yeah, I was just going to add, you know, and having worked in one of the vaccine centres in Bracknell Forest, one of the things that the vaccinators themselves are doing is reinforcing those messages at the time of giving the vaccine to individuals about needing to continue to adhere to public health messaging, hands, face, space, you know, the points that Sarah's already highlighted. That's a really important part of actually getting the vaccine themselves. You need to be continuing to reinforce those messages at that time as well.
No, I think thank you, Fiona, for that. I thought it would be the case, but I think it's worth just airing and just double check. Having
taken 3 elderly people for their injections at the Waitrose site, the advice given and the level of care and service at that place is phenomenal.
That's why I'm showing the card that I was given as I left there on Sunday. Not only did it give me my time, my date, what the number was when I entered, also the vaccination that I had had. I could not fault them. Okay?
Good. I'm gonna move us on in the interest of time. Councillor Bettison has just joined. Leader, do you wish to take on chairmanship or?
No. Very happy for you to continue in the chair, and I'm sure you've already given my apologies, but I was on a ministerial call. Could I just say, though, with regard to the vaccination centre, I had a call from a resident this morning who experienced there over the weekend. Everything was fine, but his elderly wife, who was also vaccinated, was extremely distressed. She suffers from dementia, and they just commented that he felt that he was very lucky to manage to keep his wife in there long enough to have the jab, and that it would be helpful for somebody like her if there was a more enclosed area, even if it was only curtain screens, that she could go into a room and feel like she was just with one other person instead of in the middle of a hall with about 80 people in it. Now, I haven't been in there myself, but this is from a resident, and he's very worried about how he's going to get his wife in there for the second one, and he doesn't know who to speak to.
So do you want me to come back on? Do you want me to answer that? So I'm really sorry for your residents' experience, because actually that is something that we should be able to manage. So what my suggestion is for that particular resident is that they contact their GP surgery and explain that, and we can arrange to do it in a slightly different way, perhaps at the beginning of the clinic, end of a clinic, or there should be privacy areas available in all the vaccine clinics. So we could do something. So in that individual case, and then we'll talk to the vaccine centres about how we make sure that we're looking out for that sort of thing.
Thank you, Sarah. Thank you. That's really helpful, and I'll get back to the resident right away. Thank you.
I just had a couple of, thank you for that, Sarah. I just had a couple of quick questions, actually. One is just as an update on the community testing, lateral flow testing in our community centres, etc., across Bracknell Forest, just if we can get a very quick update on that one. And the second one is with all of the news about Woking and the GU21 postcode and the mass testing for the South African variant, or variant of variant. Is that something that is on our radar? Have we seen any instances or any issues? Do we think it's spread further out, or will we learn more once the community testing is done? So 2 questions, not sure which order to take them in.
Yeah,
First, Tim.
Well, I can take the first one in that we finally got sign-off from the Secretary of State this morning for the community testing after 10 days. So we are doing the beta testing, and they've been going very successfully today, and we go live tomorrow.
Brilliant.
As regards the South African variant, we've not been notified of any cases. The last number that I heard was that there were 11 across the country that weren't related to travel, and in each of the postcodes that were affected, there's surge test and tracing going on with a tremendous amount of resource being put at it. And I'm sure that if there was a case detected in Bracknell Forest, then we would know about it and we would all be working on it.
Great, thank you, Tim, for the reassurance. I think it's just on the subject of the testing centres, just enormous gratitude to everyone that's been working so damn hard to be set up in such a quick period of time. All the legwork that's gone into it, all the coordination work. I'm sorry that it's taken 10 days for it to be signed off by the Secretary of State, but as usual in Bracknell Forest, we get on with it. And so gratitude to all of those involved in what's a Herculean task on behalf of our residents. I shall move on, unless there's anything else, we've got the communications update. Abby, I think you're picking this one up today.
Yes, thank you, Chair. I'll just share my screen with you. Should be loading now. Okay, can everyone see that?
Yep.
Okay, so currently there are 4 main communication priorities, which I'll just talk through. So the first one is obviously reinforcing and promoting the national restrictions, including stay at home and self-isolation. We've been using lots of indoor and outdoor media, including an ad bike, which has gone out into our communities, and also we've used the COVID marshals in key locations. Hard copy booklets also been delivered to every resident in the borough, which is particularly important for anyone that might not be online or digitally enabled. And we've also been working in partnership with the police to promote what happens when people break the rules, and focused on some of that sort of enforcement as well. Human communications is particularly important in terms of bringing the severity of the pandemic home to people. So we've been working for some time on collecting some case studies, one of which has gone out recently, has gained huge reach, and has also been picked up nationally. So we'd like to thank those residents that have come forward and shared case studies with us. And if anyone else feels comfortable to do so, then we'd be very pleased to receive some further case studies, because it's really important in helping us to promote important messages at this time. We've already talked about testing at the meeting. The phase 1 community testing sites will be going live tomorrow. So over the past 24 hours, there's been significant activity in terms of promoting testing to eligible groups. There's going to be a BBC Radio Berkshire interview tomorrow morning. There's been press release as well, and some photography and filming at one of the test sites this morning. And in terms of the broader testing picture, we've also been promoting the walk-through testing site at Bracknell Leisure Centre. In terms of vaccinations, as has been mentioned, we're working closely with and supporting our NHS colleagues to promote vaccination take-up, and also challenging some of the myths and sort of vaccine hesitancy. We are also advising on and sharing information about scams. Unfortunately, there are a number of scams in circulation. But we've been focusing very much on that reassurance piece and the encouraging take-up rather than focusing on operational communications, supplier numbers, vaccinated, which is being led by the NHS. So looking ahead at upcoming comms and engagement over the next month, we're going to continue to focus on the same priority themes, taking account of any changes to national guidance and the potential relaxation of the lockdown measures. And obviously, as and when it's decided that schools will reopen, that will also be a significant priority in terms of our comms and engagement with local communities and schools. The engagement team is also working with communications and public health to engage with Black, Asian and minority ethnic communities in the borough, and that's going to be a priority piece of work over the next couple of weeks to make sure that we're really getting relevant and timely information and messages out to our different communities across the borough, including ensuring that translated materials available. That's going to focus on general health advice, but also have a focus around the priorities of testing, vaccine hesitancy, and any misinformation that there might be within our communities. So thank you, Chair. That's a roundup, but very happy to take any questions.
Great, thank you for the update. I'm enjoying seeing the flurry of social media adverts. I think the one that made me smile the most recently is obviously the one that Slough have been running, which, if you haven't seen it, is quite funny, about how you should treat your mask like you would your underwear. It's quite funny. Dot had a quick question earlier, Abby, you might want to take away about have we dealt with that one, Abby? Now, sorry, Dot, have we dealt with your question about messaging post-vaccination? I think we kind of covered most of that. I've got Phil has got a question. Go ahead, and I'll come to you, Gareth.
Thank you, Chair. Thanks, Abby. It's more of a comment than a question, and that was just regarding the information booklet that was circulated to all homes, which I know did contribute to. But I have heard from the Safeguarding Board that actually it might have been a missed opportunity to promote and raise awareness of key safeguarding contacts. Should people feel that, as I say, they are at any risk during this time. So I don't know if we want to double check the content of that, but as I say, I know we can't undo what's been done, but it's just a heads up on that one.
Yeah, thanks, Phil. There's certainly content in the booklet regarding children's safeguarding. So that was included, but we can pick that up with safeguarding colleagues to see whether the comms team can provide them with some further support in getting further messages out. Thanks, Phil.
It's a great call. Gareth.
Yeah, it's early days, but the more optimistic news, and I say that with a very caveated optimistic, plus, reports in the media, we're past the peak, things like that, worry me, because actually, in terms, as Charlotte said so eloquently at the start of this meeting, we're far from past the risk. So thinking possibly not in the week or so ahead, but as we move further into this year, with, I think, people quite understandably grabbing at any bit of good news they can get, are we going to be prepared? You have to push the messaging home harder, sometimes in opposition to some of the messaging we might see in the media that actually this is far from over, and indeed, it's a complex and drawn out process to get back to what some people might consider to be normal, because I think that's going to be the real risk, particularly with the review of lockdown in 2 to 3 weeks' time and words around schools and things. It just strikes me that our message is going to have to get harder to make sure that people don't let up before it's, before the right time.
I agree with you there, Gareth. I really do. And coming back to what I said earlier, we do need to get the message over, because with like Warfield Park, that's a lot. That's over 580 odd properties up there. Have we checked that they have been able or have been associated with it all? Okay, and that isn't the only park home. where we have older persons. Okay, it was just.
I think we can pick that up. We can pick that up separately and see if anything needs to be done. But I think, given the level of spread of knowledge and of content from all of the comms team, I think we just need to make sure it's squared off. But I think we're okay. I'm going to move on unless anyone has any questions. No. Okay. So we move to questions from members of the public. And we've had 3 that have been notified to us. How do we want to answer? Who's answering the first question around data?
So is this, sorry, I've got the first question being around vaccination.
Oh, sorry, yes. So what are the plans for including and reviewing regular data as to how food vaccination programme is progressing in Bracknell Forest in future meetings of the board? What plans does the board have for informing residents as to how the vaccination programme is progressing?
Chairman, I think Sarah Bellas, who's the Director of Nursing and Quality for the CCG Collaborative and is the lead for the vaccination programme, is probably the best qualified person on the call and indeed in the region to answer this one.
Brilliant, Sarah. Top that, and thank you. And also, Sarah, welcome to this meeting, and thank you for coming today. And over to you.
Thank you, Tim, for that introduction. Maybe not the region, but
I think so.
I think the vaccine programme, the data is being released once a week by the Department of Health, I think generally on a Monday, so you should see that. What I can tell you, because obviously that's what you want to know, what you can hear, is that it is going well in Bracknell. We obviously have 2 sites, which are not a secret. And we've talked about one of the sites this afternoon. One is at Waitrose and one is at Birch Hill, and both sites are doing really well. As you know, we're currently vaccinating cohorts 1 to 4, and those cohorts are nursing and care home residents. And we can say that we've done all of our care homes in Bracknell Forest. We are also doing the care home residents and we're staff, and we're working very hard to do that. We've offered it to all staff now, and now we're working with different people on increasing the uptake in relation to some vaccine hesitancy. The next group is the over 80s and the health and social care staff. So we are working hard to vaccinate those groups, and our numbers in Bracknell are looking very good, and we'll be on trajectory to be compliant with the Prime Minister's request to do cohorts 1 to 4 by the 14th of February. December, when is that? I'm obviously living in the past.
Great news, thank you. Question 2 is around the data. Charlotte, is this yours?
Yes.
Dale's got his hand up.
Oh, sorry, Dale, I didn't see that. Can I just quickly go back to Dale before I come to you?
Thank you. I just wanted a quick, one of the things that a lot of stakeholders get, and I know I get one, is a COVID-19 vaccination update that Sarah was talking about. And one of the things that I checked was, could I send it to others? And I got told to send it to whoever you can. And I've been doing that. All council members, I've been making sure get a copy, and I then asked them to circulate that to their local networks as well. So there are updates going out into the community via councillors.
Great. Thanks for that, Dale. Charlotte, over to you for questions.
Okay, so the second question that I've been made aware of was the presentation by Charlotte Pavitt, myself, at the meeting on the 19th of January about the plans for community testing included figures that showed the latest average number of cases to the weekend in the 13th of January for the over 60s in Bracknell Forest was 378 cases per 100,000, representing nearly 79% of all cases in Bracknell Forest. If that is so, why is testing focused on working people, the majority of whom would presumably be under 60? Is the testing targeted at the right people? So I think the individual has misinterpreted the rate for an absolute figure. So this 378 cases per 100,000, it didn't represent nearly 79% of cases in Bracknell Forest because it's a rate. We use rates because they enable us to compare the data to other areas and between age groups, etc. So the absolute number of cases in the over 60s will have then been divided by 100,000 and by the population of the over 60s and then times by 100,000. So we don't publish the absolute numbers because they're quite often very small and therefore may be identifiable. And as I've mentioned, the rate is more meaningful. Therefore, I can assure the individual that 79% of the cases in that week weren't in the over 60s. And we always look to target all of our measures, whether that's testing or communications or enforcement, proportionately, prioritising where need and transmission is greatest. We're focusing the testing programme where transmission risk is currently highest. And because we're in national lockdown, individuals shouldn't be going out of the house, but those who are having to leave the house to work are at increased risk of transmission. And therefore, that's why the testing programme is focusing currently on those individuals. We are and we will continue to review the testing programme post-lockdown and look to expand to our high consequence, high prevalence population groups in line with emerging national policy as we become aware of it.
Which, thank you for that, which almost seems to segue nicely into the third question.
Indeed.
Over to you again.
Okay, so the question was, I would like to know why the board does not have evidence in front of it to show where and how transmission is occurring in Bracknell Forest in order to make more informed decisions about where testing should best be focused. So I would challenge that question. The epidemiology report, which is a standard agenda item for the board, presents the evidence that is within the public domain and focuses and sheds light on how and where transmission is occurring in terms of the geography and the demographics of the cases that I've highlighted today. Depending on the week and the agenda, we also then go on to explain how that is influencing and informing action. So I can assure the individual that confidential local intelligence is further analysed on a weekly basis to further inform action. And then, as per my previous point, we're currently focusing our testing programme where transmission risk is highest, i.e. to those who are having to leave the house to work. But we will be reviewing that post-lockdown and look to see where the highest prevalence, i.e. highest transmission rates are occurring, and also our high consequence, high risk individuals as well. And we will adapt the testing programme accordingly as long as it's in line with national policy and guidance.
Great, thank you very much for the comprehensive answers. If there's nothing else, we'll move on to the action log. To review by exception anything from the action log. Is there anything we need to be covering off from that?
Chair, I'm not aware of anything apart from the small items that were annotated in the chairman's guide. So it's just all board members to notify the board of any false or fake news so that it can be addressed and countered with accurate information. And Abby covered off earlier the request that all board members to provide the comms team with contact details of anybody who would be willing to share their COVID-19 story.
Great, thank you. And just before we move to the date of the last meeting, James Sunderland, our MP, has just asked if he can join in. James, over to you.
Yeah, hi, Chair. Just to say this is really useful. Thank you to everyone for the update. I've just got one question, really, and that relates to the supply of vaccines this week, and I direct this at the CCG. I mean, are we seeing a reduction because of the recent success that we've had across Bracknell Forest area?
So James, we are working very closely with the region, and we are matching how much vaccine goes to which area in order to make sure that we deliver cohorts 1 to 4 as per the national directive at the moment, so that we're getting the right vaccine to the right place so that the right people are done.
Yeah, thanks for that. I mean, clearly I'm aware that resources are being sort of tweaked across the UK as a whole. I mean, I get that it will ebb and flow in accordance with where priorities are being met and where they're not being met. But I suppose as a sort of, a self-confessed fan of Bracknell Forest area and a proud MP for the constituency, I'd love to see the vaccinations racing ahead and us exceeding targets in mid-February and beyond.
So we are happy to work as fast as we can work, and we have capacity to do that, and we'll work to the national direction, targeting the vaccine where it's needed.
You should be a politician. Yes. Thank you.
Great. And I think that the date of the next meeting I have down is the 23rd of February, but I did this last time and I got it wrong. Are we still for the 23rd?
Chair, that date is still the 23rd of February.
Got it right this week then. And I think there's nothing else on the agenda other than just to, again, pass on my thanks to everyone that's been involved in testing up and running, and for everyone that's been involved in the vaccination program and the comms that goes around it. Paul, do you want to say anything as the normal chairman?
No, except just to say thanks to everybody, and look forward to seeing them on the 23rd, if not before.
Brilliant. In which case, everybody, if there's nothing else, I shall close the meeting and ask for the live stream to stop.